Thank you very much, sir. How many types of diabetes exist?
Diabetes can be categorized into 3 categories. We have diabetic mellitus type 1, and these affect the children and the adolescent. Type 1, and these type 1 are usually resistant to oral hypoglycemic agent. They are very sensitive to the use of insulin. The second category is what we call the adult onset, and this is type 2. They are usually very sensitive to oral hypoglycemic agent. While the third category of diabetic mellitus is the gestational diabetic mellitus, and these occur. We have hyperglycemia that are induced by pregnancy. They occur in pregnancy and are seen among the pregnant women. So these are basically 3 classes of diabetic mellitus that are common in our environment here.
Thank you, sir. This is quite enlightening. Once one is diagnosed with diabetes, does it translate to death sentence?
No. Diabetic mellitus is one of the non-communicable diseases, unlike the communicable diseases that we have. The non-communicable diseases are diabetic mellitus, hypertension, cancers, and other cardiovascular accidents. The management of diabetic mellitus is not a patient that have diabetic mellitus is not a death sentence. It is non-communicable diseases that can be prevented, and when it occurs, it could be managed. The management of diabetic mellitus include dietary, lifestyle modifications, medical, using medications, and medical care treatment for people that have complications of diabetes. It also includes environmental modifications, screening to prevent people from developing diabetes. These are the categories of management that we have. And it's not a death sentence. It is a non-communicable disease. It is also preventable.
Thank you, sir.
Yeah.
Sir, if that is the case, what are the available treatments for diabetes patients?
The management of diabetic mellitus include, number 1 is dietary management. The patient needs to be evaluated after conducting physical examinations and laboratory tests to determine the levels of hyperglycemia and the risks and the complications that are involved. Dietary prescriptions are done to ensure that proper management of hyperglycemia occur. Nutrients that are consumed are the 6 classes of food: protein, carbohydrate, fat, vitamin, minerals, and waters. Effective management of these dietary control is very important in achieving the overall outcome that we deserve to have on diabetes. And the outcome is to prolong life, to have qualities of life, and to limit the progressions of mobility, and to prevent mortality from developing. Apart from dietary control, we have medical and surgical control that we can use. The medical control involves the use of drugs. And these medications are in 2 categories. We have the oral hypoglycemic agent that are used, and we have injectable using insulin injections. These are prescribed by physician and medical evaluations by qualified healthcare workers. In addition to the medical control, we also have lifestyle modifications that we need to do. Looking at our lifestyle, the consumptions of alcohol must be reduced, smoking must be stopped. Apart from this, exercise have a great role to play. Physical activity is very necessary. It promotes the cells and tissues of our body to mobilize and utilize glucose, protein, fat, and other nutrients into our cells and metabolize them, thereby help in the management of our diabetes. So we have exercise play a great role. Then medical screening is very necessary. Periodic medical screening and medical tests are very important in the management as well as the control and preventions of our diabetes. Then finally, environmental control is very, very important. Just like I have said before, that the risk factors include the use of organophosphate that we use in our environment. And these organophosphate include herbicide, the insecticide and pesticide that we use to control our pests, our environment. They should be controlled and used appropriately. In addition to this, consumptions of poorly prepared cassava is also another risk factor that leads to the development of this diabetes, because poorly prepared cassava contains cyanide that have been known to damage pancreas, which is an organ that produces the insulin that regulates glucose in our body system. Therefore, people must be educated to ensure that they prepare their cassava properly and prepare them for human consumption. These are steps, strategies that we can adopt to control and manage diabetic mellitus in people in our society. Thank you.
Sir, can you tell us how insulin therapy works?
Insulin therapy ensure that basically the problem of diabetes are in two food. We have excessive glucose in our blood, and these are due to either relative lack or absolute lack of insulin. Insulin is a hormone that is produced by the beta cells of the pancreas, and this insulin helps in mobilizing glucose from our tissues, from our blood into the tissues. They mobilize glucose into the cells and cause metabolism and break them down into chemical that will be used by our cells and tissues and organs of the body. Therefore, insulin is very important in the management of type 1 diabetic mellitus, because the problem of type 1 diabetic mellitus is that there is little or no insulin produced by the pancreas for the metabolism of this glucose in our system. So such people need to be given insulin injections, and the doses and the route of this insulin will be taught to the patient by the physician who is qualified to manage diabetic mellitus in our hospitals and in our clinic.
Thank you very much, sir. We go for a short break. We'll be right back.
It's not new again to say health is wealth. We all know that's true, but do you know when to check your health status? Do you care to learn about living healthy and bright? What to turn to when you're feeling not quite right? Join Healthmed Info for answers and insights to keep you in prime time on YouTube channel, Malachi TV, Facebook pages, MLC TV, MLC TV 2, Instagram, MLC TV 2021, X under Malachi TV, and TikTok Malachite_TV. Don't miss this valuable info on your way to help you live your best life every single day.
Welcome back. This is still Healthmed Info, and the topic is diabetes with our Dr. Alabi Oladele. Doctor, thank you very much, sir, for the explanation. At this stage, what are the benefits and risks of medications for diabetes?
The benefit of medications to our diabetic client are very, very important, and they are enormous, because number one, medications help in limiting complications. Without use of medications, complication will develop, and this could even lead to death. One of the commonest cause of death in diabetes is diabetic ketoacidosis. Patient will just lapse into unconsciousness, and when they become unconscious because of severe elevations of blood sugar, it could lead to death. So in essence, medication help in preventing death. It also helps in limiting mobility, severe mobility. It helps in the control of blood sugar. It also helps in ensuring that this sugar that is in the blood is utilized by the cells and tissues and organs of the body. It mobilizes this glucose into the cells. It also mobilizes them into the tissues. It ensures that the tissues and cells utilize them and use them to perform the role that they are expected to perform. So medications is very important in the management of diabetes. It also ensure that people are not dying, and also limit the complications, and also ensure that health is attained, and the cells and tissues and organs of the body could perform their functions appropriately. Complications, you say complications of medications. Yes, insulin, for instance, have some side effect, because if you have to monitor patient on insulin, you have to monitor patient on this oral hypoglycemic agent to ensure that appropriate dose and frequency is used for this drug, and this will prevent side effects and complications that could arise. Any drug, any medication, even water has complications and side effects, and therefore to prevent side effect and development of these complications, a trained physician must be the one that will prescribe and manage and monitor patient on the insulin, on oral hypoglycemic agent, to prevent unwarranted complications like hypoglycemia, the hyperglycemia. Excessive or inappropriate use of insulin or oral hypoglycemic could lower the glucose suddenly and crashes to become hypo, and this may cause unwarranted side effect that is not necessary and must be prevented.
Some people will advise that people living with diabetes should do exercise, and that it helps to manage it. How true it is?
Yes, it's very true. Diabetic management involves physical activity, and this is exercise. Exercise means you are exercising your body, you are using your body, you are mobilizing your body to enhance that functions. Our body system has functions, has processes, and has system. We must ensure that our body system are exercised regularly to ensure that cells and tissues are mobilized and ensure that they perform their role as expected. Exercise helps in mobilizing our nutrients, especially glucose, into the cells, and this ensures metabolism. It ensures the production of energy that is necessary for our body system. It ensures that glucose that are excess accumulated in the blood from diabetic patient, all this excessive glucose will be mobilized into the cell, and exercise play a great role. Inactivities, sedentary lifestyle is one of the risk factors that leads to diabetics, and that is why the management of diabetics involve exercise, physical activity to ensure restorations of body system into the normal function. It ensures restorations of cells, tissues and organs of the body to perform their expected function, and these functions include metabolism of glucose, metabolism of protein, fat and vitamins in our cells to produce energy, amino acid and fat that are necessary for growth and development of our body system.
Thank you, sir. What are the recommended diets and exercise for diabetes patients?
The appropriate and recommended will depend on individual. People prescriptions will be based on merit. Examinations will show and categorize people into what they need. So depending, like the prescribed menu will depend on the level of the glucose. After the examination and blood test, the levels of hyperglycemia will depend on the prescriptions that will be given to patient. Patient can consume all the 6 classes of nutrients, but the quantity is what matters, and then the diet should be balanced depending on the level of hyperglycemia that are detected on the patient. Similarly, exercise will be prescribed after complete evaluation of the patient, like the blood pressures must be determined, the heart rate must be determined, and patient should be evaluated based on individual, and an assessment and medical condition will determine what level of exercise that will be prescribed. We have mild exercise, we have moderate exercise, and we have people that can go into the higher category of exercise depending on their cardiovascular stature.
Thank you, sir. How can someone with diabetes manage his or her blood sugar level effectively?
The management I have described it, that the management include dietary, include the use of medication, include exercise, include lifestyle modifications, and include periodic medical evaluation and screening. All these are strategies that are adopted, holistic strategies that are used. People have to look into their diet, they have to use drugs depending on their level of sugar, they have to practice exercise involving physical activity, as well as regular periodic medical examinations and tests are necessary. Lifestyle modifications, alcohol consumptions, smoking should be stopped, as well as periodic tests. And then the environmental factor, exposure to this insecticide, to these pesticides, organophosphate, should be stopped or limited.
How often should the person check his or her blood sugar?
The normal people that have not developed diabetes should do periodic medical examinations, and this is advised 2 or 3 times in a year. They must go to the hospital for medical evaluation. People that have developed diabetics already needs to visit their physician, and depending on their status, the physician will tell them the interval and follow-up that are necessary depending on their blood sugar.
Thank you, sir.
Yes.
Finally, before we call this up, what are the possible long-term complications of diabetes, and how can they be prevented?
The complication of long-term complication of diabetes mellitus are as follows: from our heads to down. It could lead to development of neuropathy, nerve involvement. It could lead to stroke. It could lead to cardiomyopathy, diabetic cardiomyopathy. It could lead to nephropathy, diabetic nephropathy. It could also lead to infertility in couples, genital loss of libido, erectile dysfunctions are long-term complications of diabetes. It could lead to recurrent abortions, big babies, as well as diabetic foot, leg ulcers. It could also lead to pelvic inflammatory disease in female, as well as swelling of the muscles and joint, as well as the skin disorder. These are complications that are seen on long-term basis in our diabetes. By way of preventions, the preventive strategy is to ensure that these diabetics, hyperglycemia, do not develop. And how to prevent it is to ensure that we look into our diet. Lifestyle modification is very, very important. Alcohol consumptions, the use of smoking should be discouraged. Similarly, every individual must ensure that they undergo periodic medical examination from time to time as recommended by their physician. Periodic medical screening for diabetics is also very, very important as a way of preventive strategy. And finally, environmental modifications is also very, very important. We should ensure that chemicals and poisons that are known to trigger and cause damage to our pancreas is avoided in our environment. And such chemicals include organophosphate. The use also scorpion bite is another event that leads to damage to our pancreas. And environmental sanitation too should be ensured that our environment are clean so that scorpion bite, other insect bite will be avoided. These are common strategy, preventive strategy that we need to promote to prevent the development of diabetes among our people and to ensure that people that have this diabetic already could be controlled and managed effectively using oral hypoglycemic agent and insulin therapy as the case may be.
We are still on the show. We will be back shortly.
It's not new again to say health is wealth. We all know that's true, but do you know when to check your health status? Do you care to learn about living healthy and bright? What to turn to when you're feeling not quite right? Join Healthmed Info for answers and insights to keep you in prime time on YouTube channel, Malachi TV, Facebook pages, MLC TV, MLC TV2, Instagram, MLC TV 2021, X under Malachi TV, and TikTok, Malachite_TV. Don't miss this valuable info on your way to help you live your best life every single day.
Just a quick recap. Please know your status. Go for checkup at least every quarter to know how your health is doing. Thank you very much. Thank you for being our guest today. Hope to engage you on more aspects of health next time. Because if we must be wealthy, we must be healthy. Thank you, sir.
Thank you.
And until next week on this same station, Malachi TV, make sure you remain healthy to create wealth for you and your family. Please subscribe to our YouTube channel, Malachi TV. Like and follow our Facebook pages, MLC TV and MLC TV2. X handle, Malachi TV. Instagram, MLC TV 2021. And TikTok, Malachite_TV. I am Joy Dada. See you next week.